New Zealand, this is a very important document for all New Zealanders to read, to listen to be aware of, and most of all, to question our government officials about our government supposed leaders and our government bureaucrats in the Ministry of Health. This document was released under the Official Information Act 1982. It's entitled A Memorandum of Understanding between the Ministry of Health, the Ministry, that's how it'll be referred to in the document, and the Officer of the Chief Coroner, referred to in the document as OCC. The document is dated 18 March 2020. In the opening paragraphs, it says, background A. In January 2020, Chinese authorities confirmed a new type of coronavirus known as COVID-19. Human cases of COVID-19 resulting from animal to human and human to human transmission, initially identified in Wuhan, China, have been confirmed in New Zealand and a large number of countries around the world. Consequently, on 28 January 2020, the Cabinet authorised the Infectious and Notifiable Diseases Order, declaring COVID-19 a notifiable infectious disease. The order was made pursuant to Section 3A of the Health Act 1956 and came into effect on 30 January 2020 on the advice and with the consent of the Executive Council. Consequently, health practitioners and laboratories are now required to notify medical officers of health of cases of COVID-19. Paragraph C. On 11 March 2020, as a result of international spread and community spread in some countries, the World Health Organization declared COVID-19 a pandemic. A pandemic is defined by the World Health Organization as a worldwide spread of a new disease. As such, the outbreak of COVID-19 is a serious situation that carries implications beyond China and may require immediate international action, including by New Zealand. Any widespread outbreak of COVID-19 in New Zealand could have a big impact on the day-to-day lives of New Zealanders and place considerable pressure on New Zealand's health services. Paragraph D. As of this date, New Zealand has 12 confirmed cases of COVID-19 and no deaths. According to the Director of Public Health, COVID-19, and this is the key line in the whole page, COVID-19 does not have a particularly high mortality rate and it is not particularly transmissible. I'll read that line again. According to the Director of Public Health, COVID-19 does not have a particularly high mortality rate and it is not particularly transmissible. The paragraph continues. Nevertheless, the Ministry has set up the National Health Coordination Centre, NHCC. It is monitoring the situation closely and will advise of any measures needed for this virus if or when they arise. E. The parties have a responsibility to key stakeholders to inform them of the status of spread and death rate associated with COVID-19. F. Legal responsibility for dissemination of information from a coroner's case lies with that coroner. The Chief Coroner has a strategic role in overview of cases collectively. This document is a Memorandum of Understanding between the Director-General of Health and the Chief Coroner, dated 18 March 2020. It explains at paragraph C what a pandemic is, and it further explains in paragraph D that this COVID-19 pandemic has nothing to do with a high death rate. I'll read that crucial line again. According to the Director of Public Health, COVID-19 does not have a particularly high mortality rate, and it is not particularly transmissible. So it really does make you wonder why they destroyed our society and our economy does it not? Why is there such a massive divergence between what they agreed with each other and what they told us? Please remind yourselves that at all stages, Ashley Bloomfield, Chris Hipkins, Jacinda Ardern, and others, especially those left in legacy media willing to push out the government's propaganda, were telling us constantly how dangerous it was, what a high death rate we would have, how the jab, the bioweapon poison shot, would prevent transmission, and why it was essential to save lives, when in fact this Memorandum of Understanding of 18 March 2020 shows that they knew the exact opposite of all that was true. I wonder if the COVID Commission of Inquiry will give us any explanation or enlightenment on this, or moreover whether Christopher Luxon's government will call Jacinda Ardern and her government officials and the bureaucrats in Wellington who pushed this lie to account. I very much doubt Luxon will do anything, and that means it's up to we, the people of New Zealand, to us, to we the people, to hold them accountable.